Namaste, खुश रहो बेटियां. Today we are discussing a very important topic of contrast and special radiographic procedure first for B.Sc RD third semester. The topic is IVP, means Intra Venous Pyelography. Now we are starting the introduction. It is also known as IVU, means intravenous urography, and EU, excretory urography. Next is it is a special radiological contrast media investigation of kidney, ureter, and bladder. Okay, means it is a renal function test, means RFT test. Okay, so in this investigation we are studying about the kidney, ureter, and bladder. Now we are discussing about the indications. First is check for normal function of kidney. Check for shape, size, and position of kidney. Third is ectopic kidney, hematuria, hydronephrosis, bladder diverticula, enlarged prostate, ureteric obstruction, urolithiasis, kidney donor patient, abdominal injury, bladder and kidney infection, and tumors. These all are the indications. Now we are discussing about the contraindications. First is contrast allergy, means AST positive. AST means allergy sensitive test. If allergy sensitive test is positive, then we can't follow the investigations. If RFT abnormal, then we can't do this investigation. Next is pregnant lady, poor patient preparation, acute trauma patient, fever, acute abdominal pain, hepatorenal syndrome, thyrotoxicosis, raised serum creatinine, multiple myeloma. These all are the contraindications. Now we are discussing about the contrast media. Always low osmolar contrast media are used. Non-ionic iohexol contrast media are used in this investigation. 50 ml for the adult person, means the iohexol 50 ml is given to the adult patient, and in pediatric dose means in children 1 ml per kg body weight. Means if the children is 10 kg, then we can inject 10 ml. Double dose IVP means, double dose means if you are inject 1 ml, then we now inject the 2 ml per kg body weight in double dose IVP. Now we are discussing about the equipments. First of all, fluoroscopy unit with spot film device. Second is radiographic cassette. Third is contrast media. Fourth is abdominal compressor. Next, metallic markers, which are used for the patient position, which is right side and left side. Immobilization aids. Intravenous administration equipments means 50 ml syringe and filling needles. Emergency drugs and equipments, surgical gloves, lead apron, gauze piece, and spirit. Now we are discuss about the patient preparation for IVP investigation. Patient preparation is most important. First point is nothing by mouth before 8 to 12 hours prior of the examination. Tell about to take low diet and light meal before 2 to 3 days of test. Explain whole procedure to the patient. Give laxative tablets. It is a type of medicine that helps a person to empty their bowels, like Dulcolax, which is given 2 times in a day, and Flatulax, which is given 3 times in a day. Next is advised AST allergy sensitive test and RFT renal function test. Suspended diabetic patient. If patient have diabetes, then we can't do the IVP procedure. Now we are discussing about the procedure. Patient comes to the room and check the AST and RFT results and other old investigations. Now a plain film is taken to see the state of bowel preparation. If the bowel preparation is uh, clear, then we follow the IVP procedure. If the bowel preparation is not completed, then we can't do the procedure. Now IV site is introduced in the median anticubical vein. Abdominal compression is applied. Contrast media is injected. Now a series of X-ray films are taken as follows. First film is plain film, means preliminary film. Before starting procedure in supine position, 11 into 14 film size, which is plain film is uh, take for the ensure patient preparation. Next is nephrogram phase, which is take 5 minutes after inject the contrast media in supine position and 11 into 14 film size to see the image of upper collecting system and nephrogram and show renal parenchyma. The next film is secretory phase, which is taken after 15 minutes. Inject the contrast media in supine position 11 to 14 film size to see the both kidneys and upper ureter. Now we take the ureterogram phase 25 minutes after the injection of contrast media, which is taken in the prone position. Okay, in prone position, 11 into 14 size film size to see the ureteric vesicle junction and lower ureter. Now we take the cystogram phase and the pre-void phase. 45 minutes after that the contrast media, which is taken in supine position and 11 into 40 film size to see the bladder capacity and any type of bladder diverticulum. Now take the post-void, means after the maturation supine position in at 11 into 14 film size to see the bladder residual volume. This procedure takes approx 1 hour to complete the study. Now we discuss about the aftercare. Patient is asked to take or to drink adequate amount of water, take healthy food properly. Antihistamine tablets are given for allergic reaction. Thank you. The session is over. Namaste.